I wanted to be a company that would treat people with respect and with dignity. That was hugely important to me. You have to treat people as you would like to be treated yourself. Rosaleen Kelly, Managing Director of Communicare Healthcare. I'm from Mayo, Ballyhonus in County Mayo, and I did psychiatric nursing and I took early retirement in 1989. I was never inclined to sit still. I always wanted to be doing something different, and I always had an interest in the whole natural health field. So I trained in reflexology and kinesiology, and I set up a private practice in Ballyhonus and ran that for a long number of years. In 2004, an opportunity presented itself to become involved in the home care industry in Dublin. And I took a leap of faith. I suppose if I knew then what I know now, I'm not so sure that I would have done it. But I started off anyway, a country girl in Dublin, took on the challenge and opened with a few people in the office. So I started from the bottom up. I mean, I went out to clients' houses, I did the assessments, I worked as a client care manager in the company, I worked in the office, I did rosters, I manned the after-hours phones for years. I went round with 2 phones in my hand, day and night, literally. And we rode through the recession as a small family-run company. Now that was a huge achievement because we were dealing with, franchises, bigger companies that had come in from abroad. I suppose one of the things that the feedback that we get from the people that we deal with and the institutions and facilities we deal with is that we always answer the phone. We have a 24/7 service. You'll always be called back. We may not be able to cover the shift, but if not, somebody will get back to you to tell you that it can't be done. You won't be left just hanging there expecting a call. I always have a big vision of things growing, and yes, it has grown very well. In 2013 we opened an office in Claremorris, and we started in the psychiatric service. We started getting into nursing homes and community hospitals, and now we have all types of nurses, from general nurses, psychiatric nurses, paediatric, intellectual disability, we have carers, we have multitask attendants. We have carers that are specially trained in PMAV or MAPA training or Studio 3, and that's one of the specialities that Communicare is noted for. We saw a niche in the paediatric service in the Midlands, so we decided to open an office in Tullamore. Now there we specialise in the paediatric service, where we have specially trained PEDS nurses dealing with children in the home that have been in the likes of Temple Street and Crumlin, those bigger hospitals. The bottom line is that if we don't have good staff, we don't have a business, and if we don't have clients, we don't have a business. So they're what make it. Be they carers, multitask attendants, nurses, admin staff, accountants, client care managers, it doesn't matter what. If we didn't have those people, we wouldn't have a company. They're the backbone of the company, no question at all about it. And I truly appreciate every single member of staff. In the beginning, when I started out with Communicare, I wanted it to be an honourable company where there would be trust, honesty, integrity and genuine care for the client. And I'm very happy to say that I think that has gone right through up to today and as we grow, and it's very important to me that that stays that way.